Hello, my name is Rachel Osborne, and this is my case study development for advanced clinical procedures. My patient's name is Mike Sullivan. He is a 35-year-old male. Alcoholism is an ethnicity or cultural concern. Patient is often out at night drinking socially. He admits to brushing his teeth before going out, but when he comes home very late, he often forgets to brush before he falls asleep. Patient is recently separated from his partner and currently staying at different friends and family members' houses. A medical overview for my patient. Patient's medical concerns are asthma and visual disability. A special consideration is to have a member of the dental team greet patient at the door, make sure all rugs are flat, move any objects out of the way that could be hazardous and potentially cause patient to trip. Once in operatory, raise chair up so the patient can easily sit down. Always let patient know what you are doing, as well as whenever you leave the room. Patient has an allergy to peanuts, cats, and pollen. Vitals were taken: blood pressure 120/80, pulse rate 72, respiration rate 28, and temperature 99. Patient is an ASA classification 2, was hospitalized in May 2016 due to a severe asthma attack. Medication started due to disease onset are an albuterol inhaler and prednisone. To be prepared for medical emergencies, ask patient if they often have asthma attacks and to place inhaler out in plain view. Be prepared to position patient to upright seated position. Have office supply of albuterol available, and in case of an emergency, administer 4 to 6 liters a minute of oxygen. Patient presents with severe oral candidiasis. Patient is currently prescribed 2 medications. The first medication is an albuterol inhaler. A special consideration when taking this medication is to rinse with water after using to reduce the risk of candidiasis and caries. It's recommended to use xylitol products to reduce the risk of caries as well as increase salivary flow. Consult with doctor as some medications interfere with albuterol. Tell your doctor if you are pregnant or breastfeeding, or if you have heart disease, high blood pressure, heart rhythm problems, seizures, thyroid problems, or diabetes. An oral effect of this medication is xerostomia, an unpleasant aftertaste with inhalants, also being prone to dental decay and gingivitis. Another medication the patient is taking is prednisone. The dose is 30 milligrams by mouth every other day. A special consideration when taking this medication is to take the medication with food or a glass of milk. A contraindication of this medication is with systemic fungal infections. Oral effects are xerostomia, cough, sore throat, nausea, and vomiting. A dental overview for the patient is as follows. An intraoral/extraoral exam was done. Lips presented with severe angular colitis. Mucosa and alveolar ridge is very erythematous. Palate and oral pharynx, as well as tongue, have candidiasis infection. Calculus levels are moderate. Plaque, heavy. Stain, moderate, with bleeding upon probing. Occlusion is class 1. Dental charting. Probing depths are 2 to 6 millimeters. Clinical attachment loss of 4 millimeters on tooth number 4. Recession present on number 4. There is no restorative work, missing teeth, caries, fractured teeth, or oral lesions. A gingival assessment was done with characteristics written down, including gingival color, gingival contour, gingival consistency, in surface texture of gingiva. Gingival color is generalized moderately red or bright red, and the distribution is marginal, diffuse, and papillary with moderate severity. Gingival contour shows generalized signs of slight to moderate swelling with areas of blunted and bulbous papilla. The consistency is generalized marginally spongy with moderate severity. The gingival texture. There are changes in surface texture causing generalized smoothness and shininess with localized loss of stippling. Gingival color is generalized moderately red or bright red, and the distribution is marginal, diffused, and papillary with moderate severity. Gingival color shows generalized signs of slight to moderate swelling with areas of blunted and bulbous papilla. The gingival consistency is generalized marginally spongy with moderate severity. There are changes in gingival surface texture causing generalized smoothness and shininess with localized loss of stippling. This slide presents with 6 gingival images. The first image is bulbous inflamed and red papilla, fiery red diffuse papilla, and then blunted papilla. On the bottom row, there's inflamed margins with localized areas of blunted papilla, and the last photo shows a furcation class 1 involvement. A full periodontal assessment was done, including probing depths for facial and lingual, clinical attachment loss, bleeding, furcation, mobility, and suppuration. Patient presents with bleeding in 60% of their teeth. There is a clinical attachment loss of 4 millimeters on tooth number 4 and furcation involvement on 1, 2, and 19. My ADA periodontal statement is as follows. Patient presents with generalized class 2 periodontitis in 69% and localized class 3 periodontitis in 25%. Attachment loss on the mesiobuccal of tooth number 4, generalized probing depths of 3 to 4 millimeters with localized 5 to 6 millimeter probing depths on teeth 1, 2, 17, 19, 25, 26, 27, 30, and 31. There is a class 1 furcation involvement on 1, 2, and 19. Radiographs show horizontal and vertical bone loss posteriorly and moderate crestal bone changes. The American Academy of Periodontology classification is as follows. For gingival disease, it's non-plaque-induced Candida albicans infection of the tongue and palate from an albuterol inhaler. Chronic periodontitis localized to tooth number 4 with a moderate severity of 4 millimeter clinical attachment loss. Prognosis for the patient is fair. The rationale is less than adequate remaining bone support with grade 1 furcation involvement. Short-term goals for the patient are patient understanding proper home care and a goal of 10% plaque. Short-term goals for clinician are to remove plaque calculus deposits, to complete 4 quads of SRP, proper home care recommendations, to supplement patient with chlorhexidine rinse, and to arrest disease. Long-term goals for patient are for patient to understand importance of 3-month recalls, improve home care, lower plaque accumulation, to rid gingivitis and Candida albicans infection. For the clinician, the long-term goals are to maintain healthy gingival status, see no bleeding upon probing, reiterate proper recare, and full mouth probe and document changes. Modifiable factors are patient home care, oral hygiene habits, plaque accumulation, calculus, bleeding, and inflammation causing pseudopocketing. Non-modifiable factors are bone loss causing periodontitis, furcation involvement, and recession. Treatment plan and progress notes for appointment 1 are as follows. New patient comprehensive examination. Patient chief complaint is having halitosis. Reviewed medical history. Patient presents with asthma as well as being visually impaired. Took vitals. Blood pressure 120/80, pulse 72, respiratory rate 28, and temperature 99.9 degrees. Update patient drug history form. Patient uses albuterol inhaler and takes 30 mg prednisone every other day. Administered chlorhexidine pre-rinse. Took digital FMX. Radios show horizontal and vertical bone loss posteriorly and moderate crestal bone changes. A set of 6 intraoral and extraoral photos are taken. Intraoral-extraoral examination. Patient presents with severe halitosis, candidiasis infection affecting tongue and palate. Full mouth probe, generalized probing depths of 3 to 4 millimeters with localized 5 to 6 millimeter probing depths on teeth 1, 2, 17, 19, 25, 26, 27, 30, and 31. There is Class 1 furcation involvement on 1, 2, and 19. Patient presents with generalized Class 2 and localized Class 3 periodontitis. Attachment loss on the mesial buccal of tooth number 4. Comprehensive dental exam with Dr. Dennis. Discussed oral candidiasis and its link to patient albuterol inhaler. Plaque index of 88%. Oral hygiene instructions, modified Bass technique, demo to patient proper flossing, and use of interdental brush. Patient demo back to show understanding. Discussed home care recommendations and rinsing with water after inhaler to help with fungal infection. PSA injection in upper right quadrant. Administered 3/4 carpule of plain 3% carbocaine. Patient reported no pain and reacted well to anesthesia. SRP upper right quad using Cavitron, fine hand scaling, and root planing. Subgingivally irrigated quadrant using chlorhexidine. Applied Arrestin to mesial buccal and mesiolingual of tooth number 1 and distal lingual, distal buccal of number 2. Gave post-op instructions for SRP and Arrestin. Next visit, SRP, lower right, in 2 days. Treatment plan and progress notes for appointment 2 are as follows. Reviewed medical and drug history, no changes. Vitals are taken, blood pressure 120/80, pulse 88, and respiration rate 22. Administered chlorhexidine pre-rinse. Plaque index of 30%. Patient reported that they've been using suggested saltwater mouth rinse. Inferior alveolar and lingual injection on lower right. Administered 1 full carpule of plain 3% carbocaine with negative aspiration, and MI injection on lower right side, administering 1/3 carpule of 3% plain carbocaine with negative aspiration. Patient responded well with no complaints. SRP lower right quad using Cavitron, fine hand scaling, and root planing. Subgingivally irrigated full lower right quad. Applied Arrestin to distal lingual of 31, distal buccal of 30, distal facial of 27, facial and mesiofacial of 26, as well as mesiofacial, facial, and distal facial of 25. Upper right quadrant gingiva responding nicely to previous treatment. Patient given post-op instructions for both SRP and Arrestin. Next visit in 1 week, upper left and lower left quadrants of SRP. Treatment plan and progress notes for appointment 3 are as follows. Reviewed medical and drug history, no changes. Took vitals. Blood pressure 120/80, respiration rate 26, and pulse 80. administered chlorhexidine pre-rinse, plaque index of 26%. SRP upper left using Capitron, fine hand scaling, and root planing. Inferior alveolar and lingual injection on lower left side. Administered 1 full carpule of plain 3% carbachate with negative aspiration, and MI injection on lower left side, administering 1/3 carpule of 3% plain carbachate with negative aspiration. Patient responded well with no complaints. SRP lower left quad using Capitron, fine hand scaling and root planing, subgingivally irrigated both upper left and lower left quad with chlorhexidine. Administered Arrestin on buccal and mesial buccal of 17 and distal buccal of 19. Gave post-op instructions for SRP and Arrestin. Next visit will be 6-week evaluation, full mouth probing, post-operative intraoral photos, Capitron and fine hand scale all quads, subgingival irrigation, polishing, and fluoride treatment. Treatment plan and progress notes for the 4th appointment is as follows. Reviewed medical and drug history, no changes. Vitals, blood pressure 120/80, respiratory rate 20, pulse 82. Administered chlorhexidine pre-rinse. Full mouth probe, generalized 2 to 3 mm probing depths with localized 4 mm on distal of 25 and 27. Gingival tissue has responded very well to treatment and has returned to a healthy state. Post-op intraoral photos are taken. Plaque index of 18%. Capitron and fine hand scaled all 4 quads. Polished with mint flavor Profi paste. Flossed and applied fluoride treatment. Post-op instructions given for fluoride treatment. Next visit, perio maintenance in 3 months. Home care recommendations for Mike Sullivan are as follows. Prescription dental aids, Clinpro 5000. For toothbrushing, the technique is modified Bass technique. The type of brush is the gum technique deep clean toothbrush and extra soft. Brush teeth each time after meal to avoid plaque accumulation. For toothpaste, Clinpro 5000. Place a thin ribbon or pea-sized amount of Clinpro 5000 toothpaste on a soft bristle toothbrush and brush teeth for at least 2 minutes twice daily. For floss, Glide unwaxed floss. Floss 2 times a day to help with sensitivity to plaque biofilm. Interdental brushes are to be used where interdental papilla is blunted. Mouth rinses are a salt-water mix. Special instructions are 1/2 teaspoon of salt in 1 cup of warm water. Swish in mouth and then spit out. For fluoride, the type is 1.1 neutral sodium fluoride. Special instructions are custom trays are made for 1.1 neutral sodium fluoride and they are to be worn for 4 minutes or while sleeping overnight. Products to avoid with this patient are the air polisher and to use special precautions when using the Capitron due to the patient's asthma. Special nutritional needs for Mike Sullivan due to asthma and visual disability are as follows. Patient needs to add yogurt and carrots to their diet, omit from their diet shrimp, wine, pickles, and dried food, and to avoid spicy food. Patient should supplement with a probiotic as well as omega-3 fatty acid.